Hello friends, welcome to my channel. Today we're going to see about the most important basics of heart embryology and fetal circulation. The first functional organ in human is the heart and it beats around week 4. The cardiac looping starts around week 4. So do we all know what is Cartagenous syndrome? It is one of the most important points to know, which is nothing but defect in the left-right dyne and it may lead to left-right asymmetry of the heart. So the heart here is not symmetrical. So it looks like dextrocardia. It is rotated in the other way around. So now we have to know about septum primum, septum secundum. So what is septum primum? Septum primum is nothing but in embryological view, septum primum grows towards the endocardial. See, look at this image. Septum primum grows towards the endocardial cushionings, narrowing the ostium primum. And what is septum secundum? So before knowing what is septum secundum, we have to know what is ostium secundum. Ostium secundum forms in septum primum. So in septum primum, there is formation of ostium secundum due to cell death. This is called ostium primum regressus. So what is septum secundum? Septum secundum develops, see here, septum secundum. Septum, which is in blue color. So septum secundum develops on the right side of the septum primum as ostium secundum maintains the right to left shunt. So this is the septum primum as we seen above, the green one. So here septum secundum is the blue one which forms in the right side. I'm sorry. Which forms in the right side. So why it is important for us to know these? Because what we have to know what is patent foramen ovale. Patent foramen ovale is nothing but failure of the septum primum and septum secundum to fuse after birth. These both will fuse after birth, and if they fail to fuse, it is called as patent foramen ovale, and in most cases it is left untreated. But due to this may lead to paradoxical emboli. What is paradoxical emboli? When venous thromboemboli uh, moves into the systemic arterial circulation, which is right to left shunt, as it is seen in atrial septal defect. So now we have to know the key difference between the patent foramen ovale and atrial septal defect, which is nothing but flap versus the hole. So what is flap? Flap defect occurs in patent foramen ovale. This is a flap-like opening. Everyone has a foramen ovale in the womb to allow the blood to bypass the lungs. But after birth, the flap is supposed to seal. If it doesn't seal or fuse completely, it remains patent, which is open. And it acts like a one-way path that usually stays closed unless there is a high pressure in the right atrium. So like during coughing or straining. But these are mostly left untreated. Atrial septal defect. This is a structural deficiency of the heart tissue. It is which is mostly missing. And there is a permanent hole that allows the blood to flow freely between the atria regardless of the pressure changes. So these are the key features. So this is a flap-like tunnel. There is a structural hole. The prevalence is, this is 25% and this is much more rarer. And the shunting, which is mostly minimum and intermittent, this is significant, continuously left to right flow. And in echocardiography, the flap is seen overlapping. Here there is a clear gap dropout in the septum as there is a tissue missing in atrial septal defect. But these both will give us emboli risk. Both can cause emboli risk. So there are many forms of atrial septal defect which I'll cover in another video. So but this is most important point to know, because seculum, most common type of atrial septal defect is secundum type. Secundum type. It is the most important form and it occurs in the region of the fossa ovalis. It is often confused with stretched patent foramen ovale. Remember this one. But a secundum atrial septal defect is an actual lack of septum secundum tissue. So now let's move on to the ventricles of the heart. So how if we look at the ventricles of the heart, we have to know what is ventricular septal defect. This is the most common congenital cardiac anomaly. Remember, if they ask what is the most common congenital cardiac anomaly, it is ventricular septal defect, and this occurs in membranous intraventricular septum. Okay, so now let's see the outflow tract. What are the formation of the outflow tract? How come the outflow tract is formed? The neural crest cells migrate and form into truncal and bulbar ridges. These will fuse, these all will fuse together and they will form aorticopulmonary septum, which is ascending aorta and pulmonary trunk. So if there is some issues in this, obviously there will be if we have any issues in the outflow tract, so then we will have transposition of great arteries, tetralogy of Fallot, and persistent truncus arteriosus. These three are due to failure of the outflow tract of our heart. So now we know there are aortic arch derivatives. So we have to know the which part comes under which one. So the first aortic arch derivative, I'll tell you mnemonics here. The first aortic arch derivatives is maxillary artery, which is a branch of external carotid artery here, which is a branch of external carotid artery. How can we remember this? The first, I'll highlight it for you. The first one, it is maxillary. Remember it as first. We have to get, whatever we do, we have to maximize in it. So first one is maxillary. The second aortic arch is stapedial artery and hyoid artery. Here we can remember it as second. So S, it starts with S. Third one is common carotid artery. Wait, I'll show you here. Third one is common carotid artery. Here we can remember as A, B and C. So C is the third one. So third one is common carotid artery. The fourth one, it has two parts, the left one and right one. In left it forms aortic arch and in right it forms proximal part of right subclavian arch. So here we can remember as we have four limbs. So four limbs, so we can remember it as fourth arch. Sixth one is pulmonary arteriosus and ductus arteriosus. So here are the images for that. But here we have to remember one point. The right recurrent laryngeal nerve loops around the product of fourth arch, which is subclavian artery. The left recurrent laryngeal nerve loop around the product of sixth arch, which is ductus arteriosus. We need to know these 2 points. So right recurrent laryngeal nerve will loop around the fourth arch, which is none other than subclavian artery. The left recurrent laryngeal nerve will loop around the sixth arch, which is ductus arteriosus, as I said. Don't forget the mnemonics. First one is maxillary, second one is stapedial, third one is common carotid, and the fourth one is four limbs. So it should be aortic arch, proximal part of right subclavian, and the fifth one is ductus arteriosus. So now let's see what are the points to be remembered in fetal circulation. So blood in the umbilical vein are mostly the oxygenated blood, which is the partial pressure of oxygen. There is 30 mmHg. There are 80% saturated oxygen. So in umbilical vein, it will move to ductus venosus and to the inferior vena cava. See here. From umbilical vein, oxygenated blood will move to ductus venosus. From there, it will go to inferior vena cava. So via, how come? So via inferior vena cava, via foramen ovale, the blood, oxygenated blood will reach the left atrium. So ductus venosus, the oxygenated blood via foramen ovale will reach the left atrium. Follow this chart. This is one of the most important points to remember. So now we have to know how come the deoxygenated blood will move. So the deoxygenated blood will come from superior vena cava here. From superior vena cava, deoxygenated blood will come and they'll come into right atrium. From there it will go to right ventricle and then to the main pulmonary artery and then to the ductus arteriosus, main pulmonary artery, and then to the ductus arteriosus and then to the descending aorta. So this is the fetal circulation. This is the most important point. Don't forget this diagram. First it will come from umbilical vein and then to ductus venosus, and then to inferior vena cava via the foramen ovale, and it will reach to left atrium. So if we go for deoxygenated blood, superior vena cava, it will go to right atrium and then to right ventricle. From there, main pulmonary artery, and then to ductus arteriosus, and then it will go to descending aorta. So now this is one of the most important points. At birth, infant takes a breath, there is a decrease. There is decrease in resistance in the pulmonary vasculature and increase in the left atrial pressure versus the right atrial pressure. So the foramen ovale closes. Now it is called as fossa ovalis. If there is increase in oxygen from respiration and decrease in prostaglandins from placenta, there is closure of ductus arteriosus. This is how the mechanism happens. So now there are some fetal postnatal derivatives which we have to remember. So in fetal, if the structure ductus arteriosus, after the baby is being born, it will form into ligamentum arteriosum, and ductus venosus will form into ligamentum venosus. This is easier to remember. Foramen ovale will form into fossa ovalis. Allantosis, which will form into median umbilical ligament, and umbilical arteries will form into medial umbilical ligament. Remember this, allantosis, an comes, so it will form into median umbilical ligament. And umbilical arteries, it ends with al, so it will form into medial umbilical ligaments. And umbilical vein will form into ligamentum teres hepatis, a form of round ligament. So thank you. Stay tuned. If you like this video, please do like and subscribe. I'll give more updates on atrial septal defect, ventricular septal defect. Thank you so much, guys.